EMT Practice Test. Part 6. 101. Common signs and symptoms of acute hyperventilation syndrome include A. Altered mental status and bradycardia. B. Unilateral paralysis and slurred speech. C. Anxiety, dizziness, and severe bradypnea. D. Tachypnea and tingling in the extremities. The answer is D. Tachypnea and tingling in the extremities. 102. You receive a call for a 70-year-old female with respiratory distress. Her husband tells you that she has congestive heart failure, however, he does not think that she has been taking her medications as prescribed. The patient is laboring to breathe, appears tired, and has cyanosis around her lips. You should A. Begin assisting her ventilations with a BVM. B. Apply a pulse oximeter and obtain vital signs. C. Administer oxygen via a non-rebreathing mask. D. Obtain a complete list of all of her medications. The answer is A. Begin assisting her ventilations with a BVM. 103. When the level of arterial carbon dioxide increases. A. The brain stem inhibits respirations. B. Respirations increase in rate and depth. C. Exhalation lasts longer than inhalation. D. Respirations decrease in rate and depth. The answer is B. Respirations increase in rate and depth. 104. Which of the following is most characteristic of adequate breathing? A. 22 breaths/min with an irregular pattern of breathing and cyanosis. B. 20 breaths/min with shallow movement of the chest wall and pallor. C. 24 breaths/min with bilaterally equal breath sounds and pink skin. D. 30 breaths/min with supraclavicular retractions and clammy skin. The answer is C. 24 breaths/min with bilaterally equal breath sounds and pink skin. 105. Harsh, high-pitched inspiratory sounds are most characteristic of A. Rales. B. Stridor. C. Ronchi. D. Wheezing. The answer is B. Stridor. 106. A pleural effusion is most accurately defined as A. A unilaterally collapsed lung. B. Diffuse collapsing of the alveoli. C. Fluid accumulation outside the lung. D. A bacterial infection of the lung tissue. The answer is C. Fluid accumulation outside the lung. 107. Dyspnea is most accurately defined as A. Shortness of breath or difficulty breathing. B. A complete cessation of respiratory effort. C. A marked increase in the exhalation phase. D. Labored breathing with reduced tidal volume. The answer is A. Shortness of breath or difficulty breathing. 108. A conscious and alert 29-year-old female with a history of asthma complains of difficulty breathing that began after her morning jog. The temperature outside is 40 degrees Fahrenheit. On exam, you hear bilateral expiratory wheezing. After providing 100% oxygen, you should A. Place her in a recumbent position to facilitate breathing. B. Contact medical control and administer an antihistamine. C. Call medical control and ask how to proceed with treatment. D. Determine if she has been prescribed a beta-agonist inhaler. The answer is D. Determine if she has been prescribed a beta-agonist inhaler. 109. A 59-year-old male with a history of emphysema complains of an acute worsening of his dyspnea and pleuritic chest pain following a forceful cough. Your assessment reveals that he has a barrel-shaped chest, unilaterally diminished breath sounds, and tachycardia. What is the most likely cause of this patient's condition? A. Rupture of the diaphragm. B. Exacerbation of his COPD. C. Acute pulmonary embolism. D. Spontaneous pneumothorax. The answer is D. Spontaneous pneumothorax. 110. In what area of the lungs does respiration occur? A. Alveoli. B. Trachea. C. Bronchi. D. Capillaries. The answer is A. Alveoli. 111. The principal clinical difference between a stroke and hypoglycemia is that patients with hypoglycemia A. Always take oral medications to maintain normal blood glucose levels. B. Do not present with slurred speech or weakness to one side of the body. C. Are typically alert and attempt to communicate with healthcare providers. D. Usually have an altered mental status or decreased level of consciousness. The answer is D. Usually have an altered mental status or decreased level of consciousness. 112. A patient without a history of seizures experiences a sudden convulsion. The least likely cause of this seizure is A. Epilepsy. B. Brain tumor. C. Serious infection. D. Intracranial bleeding. The answer is A. Epilepsy. 113. The most basic functions of the body, such as breathing, blood pressure, and swallowing, are controlled by the A. Brain stem. B. Cerebrum. C. Cerebellum. D. Cerebral cortex. The answer is A. Brain stem. 114. Interruption of cerebral blood flow may result from all of the following, except A. A thrombus. B. An embolism. C. Cerebral vasodilation. D. An acute arterial rupture. The answer is C. Cerebral vasodilation. 115. Muscle control and body coordination are controlled by the A. Cerebrum. B. Cerebellum. C. Brain stem. D. Cerebral cortex. The answer is B. Cerebellum. 116. Which of the following conditions would be the least likely to mimic the signs and symptoms of a stroke? A. Hypoglycemia. B. Hypovolemia. C. Postictal state. D. Intracranial bleeding. The answer is B. Hypovolemia. 117. Which of the following medications is not used to treat patients with a history of seizures? A. Dilantin. B. Dilaudid. C. Tegretol. D. Phenobarbital. The answer is B. Dilaudid. 118. A 58-year-old male presents with confusion, right-sided weakness, and slurred speech. As your partner is applying oxygen, it is most important for you to A. List all of the patient's current medications. B. Obtain a complete set of baseline vital signs. C. Administer glucose to rule out hypoglycemia. D. Ask his wife when she noticed the symptoms. The answer is D. Ask his wife when she noticed the symptoms. 119. You respond to a residence for a child who is having a seizure. Upon arrival at the scene, you enter the residence and find the mother holding her child, a 2-year-old male. The child is conscious and crying. According to the mother, the child had been running a high fever and then experienced a seizure that lasted approximately 3 minutes. You should A. Cover the child with wet towels and give oxygen via nasal cannula. B. Transport the child to the hospital and reassure the mother en route. C. Advise the mother to take her child to the doctor the following day. D. Call medical control and request permission to give the child Tylenol. The answer is B. Transport the child to the hospital and reassure the mother en route. 120. When obtaining medical history information from the family of a suspected stroke patient, it is most important to determine A. When the patient last appeared normal. B. If there is a family history of a stroke. C. If the patient has been hospitalized before. D. The patient's overall medication compliance. The answer is A. When the patient last appeared normal.